With the patient in the prone lying position, we can focus more on manual techniques and mobilizing the patient. By lifting up here, we can take the neural tension of the posterior part on chains, and we can go into our spinal mobilizations, the posterior to anterior mobilizations. And we do that through the spinous processes or the transverse processes. Now, if we want to add a little bit degree of rotation in order to focus more or open one facet joint more than the other, or close one facet joint more than the other, then we can simply use the leg sections in order to create that motion here and that position. And then we can use our techniques, same manual techniques again, and then we can do that to the opposite side, and we can start working again in the same way. Sometimes we would like to have some extension. For example, if we're using the Mackenzie principles, and then we can simply use or the thorax segment that we're moving up and down. I'm just going to adjust for my back as well. And then we can block certain segments to create more movement. We just move up and down into flexion and extension maybe. Or if that's too much for the patient, we can simply do this also from the posterior side. We can use the pelvis to create that extension. We can also mobilize in this way and create some kinesthetic awareness and some understanding of where maybe some pain is coming from for the patient, and make the patient feel more at ease with the pathology. We can go further with the extensions into the thorax, where we're moving this segment. And if I want to do some mobilizations of the thorax, I want to relax the shoulders a little bit more, not have them so far up. So we can move these segments down. She can relax more, open up more, the scapula fall into abduction, and we can go down. And we can make our mobilizations. Breathe in, breathe out. And we can provide an impulse if we want. If she moves a little bit more down the table, we can also focus on the neck a little bit more. I have to move up to save my back. And here we are looking a little bit higher. And we're going into a gentle flexion and extension movement, which can be very helpful also for people with disc problems. And we can also add some rotation. Can you just move your head to the side? And here we can go into a stretch position. We can stretch the cervical musculature. Just like this. And you can go back. There we go.